Hi, I'm Dr. Ed Kanzati. I'm a clinical director for General Dental and a practicing dentist in Vancouver, Washington. Oral health affects not just our teeth and appearance, but can have an impact on heart disease, diabetes, cancer, infectious disease, birth complications, and much more. At General Dental, we understand the impact oral health has on overall health, and we take a complete health dentistry approach to care. You'll understand why after viewing this segment on how oral health affects your overall health.
Surprisingly, the U.S. ranks 6th among the top 10 countries for premature births, with 1 in every 9 babies, or 500,000 babies, born prematurely annually in the United States. Pregnant women with periodontal disease are 7 times more likely to go into preterm labor. Maintaining a healthy mouth during pregnancy plays a critical role in the prevention of preterm birth and its serious consequences.
Being a researcher at the dental school, my focus is on oral microbiology. So how oral bacteria cause infections in the mouth and elsewhere in the body. In 1996, a study was published and provided the first evidence that women with periodontitis has a tendency to deliver premature and low birth weight babies. So since then, there have been a lot of epidemiological studies to link periodontal disease with adverse pregnancy outcome. Even these mild periodontal infections, when it occurs in combination with some other secondary infection, could cause severe adverse outcomes. And for periodontal disease, it tends to be ignored because it doesn't kill. But I think what we're showing here is periodontal disease does kill, because if the bacteria gets into the blood circulation and gets to the uterus, it could kill the baby. Based on what we have seen, oral bacteria could account anywhere between 10 to 30% of these intrauterine infections. So it is a very significant cost. Not just financially, but it's also very emotionally, because if a family loses a baby, it's detrimental. People are very hurt, and they're hurt for a long time. And so they want, the question I'm always asked is, what did I do wrong? What can I do to prevent this from happening to my family again? So I think that's the big question that we want to answer.
In addition to causing birth complications, research studies have shown that women who have gum inflammation and infection and are undergoing infertility treatment have delayed results. It's much more difficult for them to get pregnant. This has been attributed to the extra hormones they are being given, which are being absorbed into the estrogen receptors we have in our gums. And in the presence of plaque germs in the mom's mouth, they cause inflammation, bleeding gums, and infection. But it stands to reason, whether a woman is taking infertility drugs or not, if she has bleeding gums, infection, or even if she just has high levels of bacteria in the mouth, then the body is going to be in a state of poor health, and pregnancy might not be possible.
When I got into dentistry, it was about 21 years ago. You did amazing today. I've got some amazing stories about actually not only saving lives, but actually helping creating lives. And so one of my patients came in as a new patient, and in researching and talking with her, she was explaining her history, how she was told she would never be able to get pregnant on her own. And in about 6 months, she was thinking about having her second in vitro done.
We started to go down the path of trying to get pregnant, and you know, my sister, I swear she could look at her husband and get pregnant. And the fertility doctor, they didn't really have a good explanation as to why we couldn't get pregnant, but they said we couldn't get pregnant on our own. You have to come to grips with the fact that you can't do it like everyone else can, you know, and so you have to try to find a good spin on it that makes you feel comfortable with it, so that there's something not wrong with you, or wrong with, what you have to do to have a child. The good news is when we went to see the in vitro specialist, he was able to do 1 round of in vitro, get good eggs, put them in, and we got pregnant on the first try with Claire. And so we carried on after Claire was born and, under the impression that we couldn't get pregnant on our own. When I started seeing Stephanie, she did a test on my teeth and said that I had periodontal disease, which I had no idea. No one had even told me I'd ever had that.
She looked healthy. She had been going to the dentist every 6 months. She had had regular checkups. She had never really been perio-charted and had been told that she had gum disease because nobody took the time. And she was impeccable on her home care. She was a daily flosser, a daily brusher. She had braces. She was doing all the right things, and this was not her fault.
She just basically said, even if you do the preventative, even if you take care of your teeth, it can happen. And then she went down the route of saying, we just need to schedule you for a descaling, and let's work on fixing it and moving forward.
We got her back on track, and we got her through the treatment. She comes in for her 6-week checkup. We do what's called a post-op check, where we get her back in 6 weeks. And when she came through my door, it was such a cool moment because she hugged me and she said, what an impact that I had on her, because she actually was pregnant. So she was thinking that she could never get pregnant on her own. And she was thinking that the only way she was going to get pregnant is to spend thousands of dollars, and that's why they were saving their money. But not only did I save her financially, I helped impact to create a life.
Look at you. You look so cool. Can I have a high five? Yes, I love that.
Coming back now to Dr. Lotting's office and being able to take Carter to her office and show her what basically the product of what's happened since then has been a joy. She took lots of pictures the last time we visited.
You're right, that is yellow.
And it was exciting to be able to kind of take him for his first dentist experience and what he was going to go through. And he's had his teeth cleaned, which he loved. But to be able to bring it full circle and have Dr. Lotting meet Carter was really special.
Does a dinosaur slam his tail about?
Yeah.
Yeah, he does. Does he throw his teddy bear all about?
Yeah.
Yeah?
I can't thank Dr. Lotting enough for helping us have such a joy in our life. Carter he's a gift. He's wonderful. He's the missing piece in our family that we had no idea was even missing until he came along. And then it was like, oh, that was the missing piece that we just needed to make our family exactly what we wanted it to be.
Hi, this is Dr. Ed Canzati again. I hope you learned something from this segment. It's clear that oral health has a direct impact on many health conditions. At Gentle Dental, we have taken this message to heart and recognize the role that our dentists and hygienists play in helping our patients maximize their overall well-being. That's why we give our clinicians additional training in comprehensive exams designed to screen for signs of underlying health conditions, including oral cancer, heart disease, and diabetes. While this is not a replacement for a medical exam, the fact that we typically see patients more often than they see their physician puts us in a unique position to help identify potential early signs of underlying problems. We at Gentle Dental embrace the complete health dentistry approach to care and hope you do too. For more information on Gentle Dental, visit www.gentleone.com or call us at 855-GENTLE7. Thank you.